Hi, my name is Aarondeep Deol, and I attend Solon High School, and I will be a senior this upcoming fall. My project was an intervention during rehab to reduce falls at home. Falls are the leading cause of injury and death in people over the age of 65. Roughly one-third of the elderly population fall each year. There is a direct correlation with the age and risk of fall. By the age of 80, over half the seniors fall annually. Once a person has fallen, their likelihood of falling again rises 2 to 3 times. The most common injuries sustained by the elderly from falls are fractures of the hand, upper arm, pelvis, leg, ankle, forearm, and hip. Falls are also the most frequent cause of traumatic brain injuries, which are called TBIs. TBIs occur in approximately 45% of fatal falls among adults 65 and older. 1/4 of older adults have a fear of falling. Once the fear has set in, older adults will tend to limit their physical activities. Implementing these limits due to their fear will slowly diminish their mobility and physical health, actually increasing their chance of falling. The average cost of fall injuries generally run around $19,000. This includes everything from the hospital to home health care. Healthcare spends approximately $30 billion annually on falls and is projected to be approximately $240 billion by 2040. Teaching proper techniques would reduce hospital encounters and could potentially start declining costs in hospital visits. In this study, we hope to compare Kindred's rehab program with the Otago rehab program and to determine whether implementing the Otago program will effectively reduce patient falls after leaving the hospital. Now, what is the Otago exercise rehab program? This New Zealand program effectively reduced the number of falls and injuries by 35%. The program had the greatest effect in high-risk groups, those over 80 that had fallen previously. This program focuses on 2 main areas: leg muscle strengthening and balance retaining exercises. The exercises slowly increase in difficulty over 5 home visits by a trained instructor. The exercises take approximately 30 minutes to complete. Patients are expected to exercise 3 times a week and go for a walk 2 times a week. Home visits are made every 1, 2, 4, and 8 weeks, and after 6 months. Follow-up home visits are made every 6 months. Many of the exercises used in the Otago program are simple everyday movements that will help strengthen the joints and muscles. Once the patient gets used to the exercises, they will begin to add weights to their ankles for more resistance. This would usually happen on the second home visit. The goal is for the patients to be able to do all exercises without support of a person or an object. Now, comparing the Kindred's program to Otago program, most of the exercises are the same, including calf and toe raises, knee bends, and walking and turning. In order for the patients to be considered for the Otago program, they must pass a series of tests that would evaluate their balance and coordination. One of the tests the patients must pass is the chair stand test. The patient must be able to stand up and sit down 5 times within 2 minutes with their arms folded. A second test is the 4-test balance scale. The patient is required to do this entire test without an assistive device. The patient's balance is tested by conducting 4 different stands: feet together, semi-tandem, tandem, and one leg. Of the 17 patients that were admitted into Kindred during my survey period, almost none of them were eligible to start the Otago program. It was observed that the patients at Kindred were very immobile, having fatigue and malaise, thus preventing all of those patients from qualifying for the Otago program. It was determined that the Otago program could not be effectively implemented on patients during their stay at Kindred. Patients at Kindred were too fragile to undertake or pass the Otago qualifying tests. The main difference between the 2 rehab techniques were that Kindred focused more on making the patient become mobile again, while the Otago program focused on strength and balance building. Strength and balance rehab effectively reduces falls in patients that are strong enough to practice them. By continuing to provide the Kindred rehab program but instituting the Otago rehab program once a patient leaves the hospital, the combined programs should effectively reduce patient falls. Some recommendations for later future studies would be to execute the Otago rehab program with home care so it is done at the patient's home instead of a clinical setting. Expand the Otago rehab program into different hospitals rather than a subacute area to see if results vary. collect data on patient fall injuries and compare those that have been on the TAGO program to those who have not, and to reevaluate the combined programs annually to determine if the programs can be modified or altered to achieve better results. I would like to thank Dr. Michael Felver and the Kindred staff for letting me be on their medical team and implement this program, and I would like to thank Office of Civic Education.